Welcome to the broadcast. You're listening to Knife After Death with Dr. Darren
Wolf. Say, did you ever hear the saxophone let out an awful moan, let out an awful groan? It makes you feel so nervous, yet it's great.
Welcome back. What a perfect day, Halloween, to make the Resurrection podcast for Knife After Death. That's right. I'm Dr. Darren Wolf, and I'm a forensic pathologist. And some of you have been fans for a long time. Some of you may be listening for the first time. But this is a podcast about forensic pathology and death and medicine and all sorts of interesting stuff. Sometimes we even bleed into art and history and literature and all that stuff. And normally, I host this podcast completely by myself because I'm an isolationist and I just sort of sit there quietly in a dark room. But we have a special treat today, and that is we have another person that's going to be talking with us today. And this is my co-host for today. And please introduce yourself.
Hi, I am Jesse Bones. Dr. Wolf and I met on another podcast. I was initially a fan because I love all things pathology. I've been an autopsy technician myself. I'm not doing that right at this moment. I have plans to get back into it. What I did was, so originally I was in school. This is like around the pandemic. Studying to be a forensic anthropologist, specialize like forensic anthropology is already kind of like a specialty. So I just was going to go subspecialty of a subspecialty and specialize in criminal dismemberment. Something I'm kind of passionate about. I don't think you should be allowed to cut somebody up and dispose of them and not get caught. So,
Right, exactly. And we can certainly address that in a podcast of its own because I during my over 3,000 cases, I have had multiple dismemberment cases, and some of them are just unbelievable because you've got the aspect of identifying the patient or the decedent, and then also determining the cause of death. And usually,
precisely.
there's a lot of decomposition involved as well, and those are definitely complex things. So I'll be excited to have your expertise on that as well.
Yeah, the one that got me, the case that I was just like, oh, I have to do this. It was kind of like a twofold. So there was like the aspect of like how egregious it was, and then there was like obviously the science aspect, which is I think what shields people like us from getting like too emotionally involved. I'm a poet at heart, so I can get kind of emotional about things probably more so than other people in this profession. However, this one, this gentleman, this person dismembered somebody and like tossed like basically pieces of her, like he flushed pieces of her down the toilet, and I was just like,
Oh my gosh.
you've got to be like, I don't
Yeah.
understand the psychology that goes behind that. Actually, I can, which that's a whole nother thing, but I just, and then it was kind of like within the realm of that case where it was two forensic anthropologists that were called in because there was like a piece of somebody that needed to be identified so that they could kind of
Mhm.
proceed with this case. And obviously this single piece was not enough. It's not like CSI or something like that, but they were passing this bone back and forth to each other, and like over the course of like an hour between the two of them, they were somehow able to discern that it was like part of this sphenoid. And I was just
Wow. That's
fascinated.
I'm always mystified. I'm always so impressed by forensic anthropologists and osteologists and people who can take like a piece of bone the size of a pea, and they're like, "Oh yeah, clearly this is this is exactly the age of the person, and this is they had osteoporosis, and
Mm-hmm.
this
Yeah,
was
just from like
probably it's just unbelievable."
osteons. Like I was
Exactly.
studying secondary osteons the other day, and there's so much that goes into it. I have a forensic conference that I'm going to on the 15th of November, so I can maybe even film a little bit from there, for our podcast and just the show. But yeah, that was kind of my bent into,
Exactly.
yeah.
Well, we'll certainly be hitting those topics. We'll certainly be hitting those topics. Some of that stuff is a little on the tangent of what my expertise is. I'm an expert when the flesh is present, and when the flesh is no longer present, my expertise starts to dry up and I give it to the forensic anthro. But today we are going to talk about not bones. We're not going to talk about bones. We're going to talk about a myth, a legend. We're going to talk about vampires. And I also want to point out that Jessie is in black and white because she exists in a realm that is only grayscale. I exist in the color world, but she is the grayscale queen. And where the realm that she is in, it's always tones of gray, black, and white.
I
So
only
um,
exist in noir.
just like the vampire. So it's a perfect tie-in. Exactly. So, with that being said, what we're going to talk about today is we're going to talk about at least one major theory on a disease condition that may have given rise to the vampire legend or myth, however you want to say that. Um, and I know that Jesse, you've done some research on some of this stuff. I did a little research. What did you find?
So a lot of what I found, we can kind of go through like on, you know, kind of with what you're talking about, because I know that you said it was like there was like what you were researching was like sensitivity to sunlight and that kind of thing. And then the fact that there's like, I mean, from what I could discern from like research that's that old, there's pretty credible documentation that Vlad the Impaler, or like the historical figure that is, attributed to Dracula, had this condition himself.
Ah, there you go. Very interesting. Yeah, I mean, if you look, at least in the information that I found, there are reports or, historical accounts of something that sounds like a vampire, a blood-sucking creature of the night, as old as ancient Greece, ancient Egypt. We're talking thousands of years ago. And then you've got the more kind of recent medieval type legends. We're thinking about, Eastern Europe and Moldova and Romania and Bulgaria and areas like that, where it's I think that it's a little more grounded in kind of the science element. And we are going to talk about the specific disease. I didn't want to reveal it just yet. I didn't want to reveal it just yet because I wanted to talk about the characteristics of the vampire first and how that does have an overlap with this one particular condition. So, what do we know about vampires? One thing is that they tend to operate at night, right? Because sunlight can be a problem. Now that's going to be a clue there. We got sunlight as a problem. We also have fangs, um, which you'll see the correlate with that soon. What else do we have? We have garlic, right?
Yes,
I
aversion to
mean,
garlic.
exactly. And the one, I think you found some information about the stake. We're going to talk about the stake through the heart. The stuff about mirrors, not showing up in mirrors and not you have to invite them in or else they can't come in your house. I don't know where that came from. But I'm
the
talking today we're going to be
Sorry,
talking
the
mostly about the
mirror,
physical manifestations.
the
Hmm.
mirror was actually, so it actually, that one kind of comes a little, there's like a couple different myths where that comes from, but one of the main ones, that I found the most compelling, that appears like, across other cultures as well, is lack of a soul. So if it's like the soul and the shadow are
Mm,
two things that are, mentioned pretty constantly, like with the undead,
hmm.
they if they're walking past a mirror, they won't like have a reflection because there's no soul to reflect, because that was what the mirror was kind of supposed to be. And what I found kind of cool too is around, give me a second, it's, yeah, 1896 and 1895. So 1896 was kind of when Stoker was talking about, mirrors, or
Hmm.
even photographs. Like when you photograph Dracula, it looks like a skeleton. He's like blacked out. It looks like a corpse. that kind of thing. And
Hmm.
around that time was when that German physicist, I feel bad, I can't remember his name, but that was when he invented or discovered the ability to do an X-ray on his wife's hand. And when she saw
Oh
that
yeah.
picture of her hand, she said she saw her own death just seeing her own skeleton. So that's
Yes.
kind of
Yeah,
where,
I think that guy may be named Rentgen or something like that. I don't know.
yeah, I
Rentgen
have,
is the unit of radioactivity, but
yeah,
huh.
I have all my books
Okay.
and notes.
No, there's a lot of interesting stuff here because one of the things that at least I know doctors like to do is they try to give explanations for worldly explanations for otherworldly things.
Mhm.
And this, uh, some of this stuff started to come up in the 1960s, where there was a paper written that suggested that there was a possible medical condition that could explain the myth of vampirism. That once again came up in the 1970s, wasn't talked about much. But then in 1985, that's when it got a lot of traction. Did you happen to see that with the guy named Dolphin? I
Yes.
personally did not read the paper, but apparently he gave a lecture and he directly attributed vampirism to this one particular disease. And that disease, if you want me to go ahead and talk about it, is porphyria. Now, porphyria, which I went through medical school calling it porphyria, like there's something wrong with my
I
brain where that second syllable
automatically
turns into an
refer
O.
I automatically refer to that as Porphyria as well, and I don't know why. I think we all kind of have
I,
like this infighting when it comes to how to pronounce specific medical things. I don't know if you've noticed that.
Oh, no, believe me, because if I pronounce something online and I'm doing a video on something and it's pronounced differently than someone learned it, they definitely tell me about it and they tell me how stupid I am.
There's one that used to
Do
absolutely kill me. There was
yeah.
one that destroy. So this was when I was in anatomical pathology, and I
Mhm.
got promoted to run the cytology department because I loved it and I just was good at it. So they just kind of like gave that department to me to watch over,
Mhm.
basically. But I was the cytotech. But I remember I sent specimens back to somebody when the pathologist assistant, and I was like, hey, I have specimens from the duodenum. And he
Oh,
goes,
that's
don't
the
you mean
one.
duodenum? And I said,
Yeah.
I've always heard it as the other one. And he goes, no. He was like, don't say it like that. You sound like a dwad when you say it like that.
Yeah. Yeah, there are rival gangs these days. It's you either choose duodenum or you choose duodenum, and you cannot do both. And life, the entire medical community is split. I happen to say duodenum, honestly.
I do,
Um,
ever since he ripped me apart for that. I do also
I
say,
think I said duodenum before I went to medical school, and then I was transformed into a duodenum person. The other
I
one
don't want to
is,
sound like a
you know
dwad.
what?
So
Yeah, exactly. The other one is the prion. And I love talking about prions, but there are people who say it is pronounced prion, and I want to just put an ice pick into my ear canal when somebody says prion.
I
But I
disagree
think
with
that's
that.
how it's said.
So I am with you. I say prion. I will never not say prion. Please come for me with hammers. I don't care.
Exactly. And I've got a Prion video coming up that I was going to put on TikTok because I've been talking about scary diseases
Mhm.
and Prion diseases like mad cow disease and Creutzfeldt-Jakob disease and stuff like that. And I just know when I put that video up and I talk about prions, there's going to be comments that say you're pronouncing it wrong. It's prion. Anyway, sorry. So I'm getting a little, but porphyria is now let's talk about porphyria because this is the key. This is exactly why we're here today to talk about vampirism and this guy named Dolphin. That his name is not Dolphin. His last name is Dolphin. He's not like it's not like Madonna where it's one name and he calls himself Dolphin. It's it's I don't know his first name honestly, but he gave this lecture and it got a lot of national attention. And people said, "Aha, this is it. This is where the vampire legend came from." And porphyria is what he attributed to. So what is porphyria? Now, you have to first know what hemoglobin is. Hemoglobin is the protein within red blood cells that carries oxygen to the tissues. So when we breathe in into our lungs, the oxygen comes from the air, it goes right through the capillaries and into red blood cells into the hemoglobin. Hemoglobin then goes to the tissues, whether it's, the kidneys or the brain, deliver the oxygen and then head back to the heart. Um, Hemoglobin has a synthetic process in the body, a biosynthetic process, and there are many enzymes that lead to the production of hemoglobin. If one of those enzymes is not working, either it's not there or it's not functional, then you get a backup of the precursor substances, and those are called porphyrins. So the backup essentially of the porphyrins in the body is what gives rise to the symptoms of porphyria. So that's what we're dealing with here is we're dealing with hemoglobin synthesis. And I also want to just mention because there was one thing I wanted to talk about. We can talk about how they were supposedly villages, were having like livestock losses or they were having infectious problems, that curses, that sort of thing. And one of the things they were doing is they were digging up the bodies of the people who were recently deceased. And they were looking at those bodies and they were making this is part of where the legend came from is they were finding these bodies which didn't have very much decomposition and supposedly had quote unquote fresh blood around the mouth. What do you think about that, Jesse?
I mean, not to be a death investigator over here, but immediately what pops into my head is purge.
Yeah, exactly. And so the listeners or the viewers here, because we're going to have a video and audio version of this, purge fluid is something that comes out of the mouth and nose after death on, I won't say everyone, because you never say all or never in science. It's usually, but basically what it is it's kind of a reddish, possibly blood tinged fluid that results from usually it results from when you have stoppage of the heart, you have a little bit of pulmonary edema at the very end with cardiorespiratory arrest, and then that builds up into the airways. And what happens is over time after death, over the few hours after death, that fluid actually will come back up through the airway, out of the mouth, and out of the nose. And seasoned investigators can sometimes refer to this as blood. Um, Certainly, junior investigators sometimes just call it blood. And I have other people, EMTs, police officers, and things like that, who will say, a body was found with blood around the nose and mouth. But it's not blood. And I have a feeling that when these people were digging up these corpses 500 years ago, they were seeing purge fluid around the mouth and they were thinking that it was blood. You just have to, and I know this sounds weird, but you just have to see a lot of dead bodies to be able to know what is blood and what is purge fluid. And usually it's just thinner. It's in terms of thin, I mean it's less viscous. It's very watery. It's very reddish brown tinged versus actual blood, which tends to be dark after death. This is not oxygenated blood. So the notion of fresh blood around the mouth, and also the other one was that there wasn't much or at any decomposition with these bodies, and so uh, that is probably because why they buried the body under the ground a few feet in cold soil. The
Especially,
body, it's
yeah.
going to be refrigerated at that point. So it's not going to be rotting. So anybody who was digging these bodies up, they were saying, oh my gosh, this must be a supernatural thing because there's no decomposition. And they must have got up and got out of the grave and fed on somebody because they've got blood around their mouth. That's where it comes from. But how does this tie back to the porphyrin issue? Well, it's a little more complex than that because there are porphyrias. I still want to say porphyrias. I'll never, I'll be 90 years old and I'll be in a nursing facility and they'll say, Grandpa, tell me about vampires and tell me about the disease of vampires. And I'll say, well, it's going to be porphyria. I'll say it because I just can't get it out of my mind, but it's porphyria. Uh, at any rate, there are actually multiple types, and we're not going to go into a full hematology biochemistry lesson here, but there are multiple types of porphyrias that give rise in each one to symptoms which I think together in aggregate kind of created this myth. I don't know, did you
Question
find
for
anything
you.
else? Yeah, sure.
So, when you say various types, kind of what pops into my head sometimes, and maybe it's just because it's kind of a common one that I see a lot with younger people for some reason. I've also worked in primary care for quite a long time.
Mhm.
But like Ehlers-Danlos syndrome, how it's like kind of like there's a lot of different things like with connective tissue, like just
Mm,
different systems. Is that kind of the same
exactly.
theory?
It is in that there are multiple types. In the example you use with Ehlers-Danlos syndrome, there are multiple types. I think it's type 1 through 4. I could be wrong about that. I'm not really a connective tissue type doctor, but there are multiple types that have different manifestations, and that's the situation with porphyria. Is that there's one called porphyria cutanea tarda. There's
Mm-hmm.
one called congenital porphyria. There's one called variegate porphyria. And there are a number of them. Well, what makes the types of them? Well, what makes the types is the enzyme, the actual enzyme that's producing the hemoglobin, which one is knocked out. That will give rise to that specific type of porphyria. Okay. And also the age of the patient is quite different. Some of them, like the congenital, these are going to be babies and toddlers. And then there are other ones that occur later on in life. But what's interesting to me is, and I found this most interesting. Maybe other people wouldn't find this as interesting, and we'll talk about symptoms in just a moment. Is that most of these, or a lot of these porphyrias, are autosomal dominant in their inheritance. So I don't know how much genetics you've done, but uh, autosomal dominant basically translates to if one parent has it, the child has each child they have has a 50% chance of having it. So why is that interesting? Because if you're thinking about like an isolated village that has 100 people in it or 200 people in it, the odds of mixing, if that gene is present, it becomes a lot higher. If you have 2 or 3 people with that gene and they're uh, having babies, the odds of there being a cluster becomes much higher. And an example where I live is that there are two examples where I live. One is Huntington's disease, which is this is a disease that is also autosomal dominant, and it's a movement disorder. It's kind of like a dementia and movement disorder disease. It doesn't show up until the patient is like 40 years old. So as a result, you have people who are much older and they are of childbearing age and they can have kids and then they manifest the symptoms. So you can't really predict it. So there's a cluster of Huntington's disease in Indiana where I live. And also there is a cluster of early onset Alzheimer's disease where I live. And so the correlate here, what I'm getting at is this cluster of people, these of similar genetics living in the same county, for instance, they're going to have a much higher rate of producing that disease through just random intermixing than would be anywhere else in the country once you have the cluster. So the reason why I found it so interesting is if you imagine hundreds of years ago, like a village in eastern Romania that happens to have 2 or 3 or 4 or 10 of these genes in the very small population, you're going to have more of these porphyria diseases. You're going to have more of these porphyrias, which the symptoms, which we're going to get into just shortly, are pretty dramatic and can be severe. And so I'm just imagining it from the perspective of, let's say, a nearby village that sees what they interpret as probably like a curse, because back then modern medicine, there's no such thing as modern medicine. We're still talking about curses, and people didn't even realize the circulatory system was what it was until like the 1600s. So to me, that gave a nice explanation for why a disease with such odd and specific symptoms might have been perceived as some type of supernatural or curse type situation.
That's kind of why
But
I raised my eyebrows a
um,
lot when you said the part about the genetics, because much like with what you said, the interest factor becomes like how prevalent then that becomes with 50% chance of being passed to children. So it's just like it kind of like if that's just
right.
what you consider to be vampirism, like you're basically just breeding villages of vampires essentially.
Yeah, yeah, that's what it might look like from another's perspective, or even from within that same village. And we also have to remember that, in modern times, a family might have one child or two or three children. Less families these days have five, six, seven, eight kids, but back then they had 9, 10, 11, 12 kids because there wasn't such a thing as, birth control or family planning. They just sort of did their thing, and then you've got a 50% chance. If you've got somebody with the gene, with the disorder, then now if you have 10 kids, 5 of them statistically are going to have this disease. So I just really liked that because it showed how the cluster could occur, and if you imagine hundreds of years ago, people trying to interpret what is happening, why are these odd symptoms occurring in this small group of people? And I think now is a good time to talk about the symptoms and how they correlate, why Mr. Dolphin and other people had thought the porphyrias were related.
one thing
One
to
of them, um, yeah,
one thing to mention too is
no, go ahead.
something I always try to bring
Mhm.
up a little bit just when it comes to, again, anthropologically speaking. um One of my English teachers did a really good job at kind of explaining to us, like, I think she used McCarthyism and then the witch trials and those kinds of things. But people have,
Mhm.
when you get like for some reason large groups of people together, they have such like this need to just not look further into something. They come up with an explanation, everybody's convinced, and it's that explanation that convinces them to do things like crucify people or like dig up corpses
Witch
together.
trials,
Yes, so
witch
it's just,
trials, for instance.
yeah, so it's just like, with that prevalence of like, if you've never read the book Madness of Crowds, read it because it'll terrify you, but it also just kind of like gives you this need like within yourself, if you're in like a crowd that's being whipped up like that, to just kind of like stay grounded, be calm, because
Yeah.
like it's not really second nature. People get kind of swept away with their fear rather than just trying to like stay in their head and just be like, okay, like here's like a list of things that could be prior to all of us going up to dig up this dead body just
Right.
as a posse.
We can add that book to the Knife After Death book club, and we'll do the
Okay.
book review on
That
that
works
one.
for me.
Because I haven't read it. Sounds like a good book to me.
There's a
But
bunch of
let's talk
books
about
that I
these
could
symptoms.
recommend. So
Yeah, I love it. The more people read, the better, in my opinion.
yeah.
But so what I want to go over is that there are multiple forms of this disease, and I don't think there's one form that has all of the characteristics that you might confuse with vampirism. But one that stuck out to me is the congenital porphyria, at least by my reading. The patient can have receded gums, making their teeth look longer. So I think maybe that's where the fang issue came from. And here's the other one that I really thought was interesting here is that they have something called erythrodontia. And what do you think that means, erythrodontia?
I'll be honest,
Dontia. I
I've not
wouldn't
heard
say,
that one. However, I'm assuming
yeah,
it's
eryth. Well, so like an erythrocyte is a red blood cell.
yes.
So eryth means red, and Dont, meaning teeth. They
Yeah.
had red teeth. So
I
the
was gonna say,
teeth
is
were
it
stained red.
yeah. I was like, I knew it has
Yeah,
something to do with teeth for sure.
exactly. So they had the red teeth with the receded gums, and that could be interpreted, you can imagine, by a medieval peasant as somebody who had been sucking blood out of somebody's neck or wherever. It doesn't matter. But the erythrodontia, the receded gums, and also this is a very common symptom across many of the porphyrias, is that they can have red urine or even purple urine. In fact, the word porphyria derives from, I think, a Greek word meaning purple. And they can have
Yes.
purple, which is kind of wild. They can have purple feces or urine. So but red, I think, is the one that stands out here because you have to understand that back then people did not understand physiology. They did not understand that, uh, you know, probably how the kidneys worked, what urine was. So if they see red coming out of the body as waste, it wouldn't be a complete stretch to imagine that they got the that was blood and that it was because they had taken blood in. So I think that that's where that comes from, that they think that the consumption of blood is what led to the red feces or the red urine because they were taking it in and then their body was putting it out. Um, the other one is we've got the fangs, we've got the red teeth, we've got the red urine, we've got the buried body that doesn't have much decomposition. But the other big one is the light sensitivity. And in this case, now remember what a porphyria is that there are porphyrins, those are precursors to hemoglobin building up in the skin. And what happens is when you are exposed to UV radiation from the sun, it causes blisters. And so, what does the vampire famously not like?
Sun.
Sunlight. And all the movies we've watched as kids and as adults, um, what do? They'll flip back the curtain or they'll open the door, they'll open the casket and the sunlight comes in and it burns their skin. And that's how the vampire is vanquished. But in this case, somebody with a porphyria can have a pretty severe reaction and they get essentially burns. They get like blisters on their skin. So imagine how that would have looked 1,000 years ago. That person would have learned to not go out during the day and
There's
they would have
a
went
and
out at
then
night.
another one that I can bring up too, which is actually I have this. It was, and maybe you can actually chime in on this just medically, because what I was told when it happened was it was like a dormant thing I had that was activated by an antibiotic. So there's another one very similar. It's like caused by, not just sunlight, but even just like the warmth from it. But I have something called polymorphic light eruption, which is,
Oh,
yeah.
okay.
So it's same thing, sensitivity to sunlight. I've always been, I was dark when I was little. I'm half Cherokee and half Scottish. So
Hmm.
I used to tan when I was little. And then at some point, my body just decided, just kidding, you're going to be pale forever. And so,
Right.
but yeah, so I always used to, like, as I aged, I would burn, but then I started getting like these little, and I would notice them on my chest, like these little
Hmm.
patches, and they're not quite pimples, but they have that like
Hmm.
weird like appearance. And I'm lucky they're not as painful as some people describe, but they're very itchy. And then
Okay.
you can feel heat coming from them, but it happens anytime, even if I'm like shaded, like with like a net or something, because
Hmm.
I noticed it, this just the rays getting through, even though I wasn't burning, was like causing that rash to just
Yeah.
erupt.
We may have to test you for porphyria. I mean,
Right.
I mean, seriously, we may have an actual vampire on our hands
I
here.
don't pee red, so
Um, yeah, yeah, there you go. There you go. Um, and so the skin, this would have produced a situation where the person would have not wanted to go out during the sun during the day, and if they did, they would have gotten burnt. They would have been going out at night. And anybody that's creeping around in the darkness, even if they're well intentioned, it's not gonna play well, I think, for locals. Especially if you've got like a goat that goes missing, and you're gonna blame the person that's out in the middle of the night, right? There's one more that I thought was really interesting in this one, and that is what do people hang on their doors when they don't want the vampire to enter? Well, you could hang a cross, but there's something else, a garlic, right? And so the garlic, I thought this was something that they just made up out of their thin air, but this actually has a correlate. So garlic contains a lot of sulfur, and apparently these sulfurous compounds can trigger a porphyria flare up. And so you can imagine somebody who, and I don't know how common garlic was back then in various things that they would cook, but you can imagine that if somebody is taking in garlic in the food and then they have this eruption, they have this flare up of their disease, then that could very easily, once people talk about the disease and they tell their friend and their friend tells their friend, then it seems like, oh, you know garlic is a kind of a way to ward these people off. And so it sounds like that's probably so some of the theory about porphyria being related, I don't think it's too off base really. Because there are a lot of similarities. It just doesn't occur in every person the same way and in every manifestation and type of that disease. I think there's 5 or 8 types of it.
I think it's the garlic part's actually fascinating because there's some cultures that do use garlic, regardless of vampires to ward off like evil spirits. But the fact that that would then
Mhm.
possibly cause a flare up with somebody that had this condition, I mean, that's pretty.
Right.
That's
Yeah, and if there is and again, you have to picture yourself not now, but you have to picture yourself 500 years ago. How would this have looked? You've got this village. They're having some kind of maybe the plague is being spread around. They're having bad luck. Livestock is dying, and they're trying to put it together. What's the cause of this? And they say that these people that we find suspicious, well, guess what? They don't like garlic. And then that's how they have flare-ups of this when the garlic is being used. So we're going to put garlic on our doors and we're going to wear garlic around our neck. Um, I think it's pretty fascinating, really, but also one thing I want to point out with this particular situation, and this is where I think there was some pushback on this to Dolphin actually, and I keep bringing him up, but that's the name that kept coming up is this
Mhm.
particular guy. Is there was a feeling that he was kind of scapegoating a group of people who have these very real diseases, who are who suffer from these diseases. I actually do have a cousin that has a porphyria, so
Really.
I am familiar with this disease. Yeah. But I just want to make clear that we're not trying to make this into some sort of sideshow. That we're discussing this academically and kind of like trying to put ourselves in the shoes of people 1,000 years ago or 500 years ago, trying to explain this.
Speaking of
Um,
trying to explain something, did you happen to cross paths with the stake through the heart?
I did not. I did not. I felt like I found good information on the other stuff, but I could not find stuff about the stake. I will say first that the cross, the symbol of Christianity, that made sense because I mean, that's sort of, in Europe at the time. It's just part of the culture. So that one I didn't really need to research much. But the stake through the heart, no. What did you find?
So it was happening in parallel with this other thing that was going on at the time, like that was a common practice. At first it's going to be funny and then it's going to be very sad. So
Oh no. Okay.
there's at the time it was illegal to kill yourself.
Hmm.
So you might be wondering how you enforce such a thing. So you would have a very shameful burial, probably drugged through the streets, your corpse buried at a crossroads, stake through the heart. just
Wow.
just like the death. I have to apologize. Like this is where it comes like to like death care people just being a little bit morbid. We all have a little bit of a sense of gallows humor, and I was just
For
like
sure.
I was laughing just at the sense that like just everything you can to get back at this person that's no longer here. So that part was making me laugh because I'm like, that's just the definition of petty. But then it got
That's
kind of
super petty. Yeah.
yeah, and then it got kind of dark because one of the things that they did do was any your estate, anything that you had to give to your heirs was then confiscated basically by the state or the government. And so I mean it directly impacts your family members.
So
So
you mean if you killed yourself, then the government took everything? Is that right?
after your shameful burial, on top of that, they would take everything from you as punishment, even though the person that's ultimately facing that punishment is your family. But eventually
Wow.
that practice, because around that time, obviously, like kind of like you said, they're digging up bodies to look and see, if they can detect any amount of like, walking among the living. And
Hmm.
to pin them to their coffins, basically to make sure that they could not move, they would stake them through the heart. There's been like other adaptations
Wow.
within like other storytellers, that kind of thing, that talk about like the heart being somehow involved, but ultimately like if they don't have souls and that sort of thing, that kind of negates that aspect. But originally that was just a mechanism of just keeping them pinned inside the coffin.
Wow. That's really interesting. No, I had not heard that. And also you can imagine, just those rumors spreading of, we opened the coffin up and there was the stake through the heart and
Mm-hmm.
how that could get misconstrued over time.
Yeah, yeah,
And yeah, we
exactly.
kept him down. We kept that vampire down because we had the stake through the heart there. That's interesting. Did you find anything else on the Porphyria side that you wanted to talk about? Because there is at least one other disease that I saw as an explanation for this.
Other than kind of like you were saying, like it presents different in everybody, which something I kind of wanted to circle back to that you said at the beginning. It's never always or never with medicine. Because I mean,
Yeah,
you could have somebody that has no symptoms of something and still have, that disease, or have very little symptoms to where it's kind of confusing because it's not presenting the way that you would expect it to. You see that a lot in
yeah,
primary care. And it does kind of make people feel like they're going crazy sometimes because it's just like, it's another thing we always, I feel like, need to be careful about, like in medicine, where it's like, sure, you have neurotic patients sometimes that, you know, maybe what they're going through is more psychological, but they feel like it's presenting physically. But sometimes
yeah.
the person whose responsibility it always is to, figure out if somebody's being a little neurotic or if there's something going on that's just kind of like tearing them up inside that we can't see yet. That's always the responsibility of like, the medical staff.
Exactly. And the other thing with not some of the diseases that you're talking about, and this disease as well, when you talk about ones with a genetic component, there is such a thing as incomplete penetrance, which means you have the disease, but your manifestation is not as severe as somebody else's manifestation. So
Yes.
it's the same gene, it's the same disease, but you might only have light sensitivity, whereas the other person is peeing red, they have the blistering, they have the erythrodontia, that whole thing, which can make for a, kind of a heterogeneous um, group of diseases and how they present as well. And I
Or
think that that
also
does present
very
some of the problems.
severe abdominal pain, which is another thing with porphyria that I read. A lot of
Yes.
patients have very, very intense abdominal cramping and just pain in that region of the body.
And that particular symptom is so difficult for any healthcare provider to figure out. What is this? Is this something terrible? Are you rupturing your abdominal aorta? Do you have colon cancer? Is it IBS? Is it indigestion?
Because it
And
really only
so
comes up like with
I often
labs.
wonder,
Sorry, it really only comes
yeah,
up with labs. Like you'd have an elevated CRP, and then kind of like, unless you were like trying to target, rheumatoid arthritis or something connective tissue wise, if it comes up like elevated CRP with like normal lipase, that one's kind of hard.
yeah. And the in this particular case, I think that since most of them do have a strong genetic component, family history would be a big one on this one, But I know a person who has it who didn't appear to have any sort of family history of it, which is kind of interesting because, things can come up. You can have spontaneous uh, diseases that are considered genetic because, I mean, if you think about thousands of years of living, I mean, these diseases had to come from somewhere. They come from some kind of mutation. As a de novo is what they call it, a de novo mutation, and then it carries on if it doesn't produce lethality. And diseases like this would not be immediately lethal to the patient, much like when I talked about Huntington's disease earlier. These are diseases that people can still reproduce, and then they find out later in life they have this disease, this dangerous disease. I'll tell you one as far as other diseases here that I wanted to talk about is when I was reading about the sort of vampire legend. Other people had mentioned rabies as a as an explanation. I wasn't as high on this. Um, I did not feel great about this. There were a couple of things I think do match, but rabies is a disease that it comes from a bite, so that fits, right? We have a bite usually,
A bite that could possibly come from a
but
bat,
it's
but
a and a bat, because if you think about like the sort of cartoonish version of Jack Dracula, where he turns into a bat, it does make you wonder if that's where that came from, because bats are vectors for rabies, and in fact, I sometimes hear about, and this is just a public health thing I wanted to talk about for a second. People will say, "Oh, yeah, I had a bat in my house, and I just grabbed it and got it out of there." You have to go to the doctor if even if you did not sustain a bite, because people can get rabies without evidence of a bite. A lot of people don't like to realize that, but um, yeah, if you find a bat in your house, you have to go to the doctor. You have to go probably get rabies shots.
it is astonishing to
And I
me.
remember at
It
yeah.
is astonishing to me how, because I've had that story before too. And don't get me wrong, I understand bats are cute. I call them sky puppies, but you do not need to go out touching them if you are not somebody that has an education to do that. But the amount of people that will come in to see us with a spider bite that's 5 years old versus I touched a bat yesterday,
Oh my gosh.
it's just
Yeah. Well,
there's a
well, there's
disconnect
been a
there.
theory. There's been a theory that the saliva of the bat is enough to transmit the disease without a bite. So, for instance, let's say you're sleeping in your bed, the bat comes down, maybe it flutters around your head, and it goes back up in the corner. There have been people actually get rabies with no evidence of a bite. So they're thinking it has something to maybe do with saliva if it, comes up onto your face and I don't know, somehow you get it into your mouth or something. But the rabies, I wasn't real cool with, except that um, photophobia is a symptom when you have rabies, and photophobia meaning fear of light. So you've got fear of light, you've got possible history of bite, you've got the bat stuff. I just didn't feel like it matched up very well at all. And the other thing is, when you think about rabies and diseases like that, it's a very aggressive disease. It's if you've seen videos of patients that have rabies, they are really suffering. I mean, they are in horrible pain and they are delirious and that sort of thing. When you think about the vampire, at least as we know them in legend and we know them in pulp culture, they're sort of like sleek creatures of the night that are not necessarily even skulking around, but they're just sort of like smoothly living in the shadows. And I don't really think that fits with rabies very well
It doesn't, and
because,
especially when you think of them as like the undead, um, you know,
yeah,
the shadow of somebody. Like, so it's just kind of like there's still decision making capability. There's still,
yeah,
because it is very much like this from another world type of thing, as opposed to just an out and out monster. I know that it's kind of like categorized as a monster in a lot of ways, but it
yeah.
would not fit the basically like what would be considered like psychosis and like deteriorating mental state of somebody with like late stage rabies.
Exactly. Now, I love to talk about rabies and also prion diseases because I love to talk about zombies. And we'll do that at some point. We'll do that at some point because it's one of my favorite topics. And we can do our crossovers into some of the movies that we like and maybe even have problems with with the 28 days later and stuff like that. Um, I guess, in conclusion, like if we just sort of like go back and think about this, I think that I actually sort of feel good about the porphyria being a reasonable explanation for how this legend myth came about. And it just turned into, it's a real thing where real people suffered. And then I think it sort of became a game of telephone where the village two hills over, learned of people that were suffering from this disease. And then they told people when they were traveling. And then they told people when they were traveling. And it just keeps getting bigger and bigger and bigger. It's the sort of game of telephone that we lose or add details as it goes from person to person or group of people to group of people. And, but, other people would just say, "Man, you're stretching too hard. You doctors are stretching too hard. It's just somebody that just made it up, and there's no historical basis." Well, I don't know how much I think there's a kernel of truth in everything, right? I
Yes,
mean,
I
when you
agree.
have these kind of monsters, I mean, we could talk about all sorts of things, like in terms of Frankenstein, we're going to go to another monster there. I mean, was there somebody at some point trying to resurrect a dead body using electricity or something? I mean, I think that was probably a very reasonable thing to try 150 years ago or
I loved
whatever. And
have you ever read
yeah,
Frankenstein, like the actual novel?
I did read Mary Shelley's book. It was a long time ago. It was probably over 20 years ago for me. So I don't have like a photographic memory of the entire book. But yeah, I did read it.
My I had such a weird kind of healing experience honestly with it, because I loved it as an adolescent, obviously. But she apparently had shortly before, like, beginning to write the story of Frankenstein, she had lost a child to miscarriage.
Mm,
And she
mm,
was like, an 18-year-old newlywed. And right before I went to go work in the morgue for the first time, I'd also had a miscarriage. And then like the
mm.
only children I had contact with like throughout the entirety of like my stint, so after having my miscarriage, like a week after that was my first experience with a child that was being autopsied, that I
Oh,
had to autopsy
yeah,
because of
that's
child
tough.
abuse. So that was
Hmm.
rough, but I read Frankenstein throughout that entire time, and just I feel this very, it's weird to say I know because she's like centuries older than me, but like this very profound connection with this woman who somehow understood anatomy without having dissected somebody herself. And it was just,
Yeah.
I loved that. It's
Uh,
a like really traumatizing experience in my life, but also like one that I just like look back on very fondly.
yeah.
Yeah.
Well, I mean, that's once again, and I know that you and I are the same in that we love literature and we love learning and we love reading. And I always try to stress this, whether I'm, on my social media or whatever, that the experience that you just talked about shows how, being engaged with some type of literature that might be 200 years old, it helped you during that time. And that's a rough time, especially
Yeah.
doing that work. that's something I haven't talked about a lot on this podcast or much really online because it sort of gets, blocked and covered up. But the pediatric portion of our job is without question the most difficult. And I think that that's the dividing line between people who want to become forensic pathologists and people who do it and people who don't.
Yes.
I have a lot of people tell me, I would love to do your job, but I could not do kids. If I could do it without doing kids, I would do it. And I'm like, well, unfortunately, you have to do it. If you're a forensic pathologist, you have to do those kid cases, um, which is a little bit off topic from what we're talking about today, but
Yeah.
we will address that at some point.
Yeah. I'm
There's
very
an
passionate about
entire
discussing that.
you know, and I'm not trying to go on too much of a tangent, but those are some of my favorite cases because I feel like I try the hardest that I can possibly try because I know that there are parents grieving, siblings grieving, and things like that. And that's one of the great things about our field is that when you do these type of investigations, you can give people answers. Sometimes, most of the time you can. Sometimes you can't. But that's one of the things I love most about forensics, and death investigation in general. Um, is there anything else? I always love to kind of like pick your brain on pop culture stuff. Like, do you have like a vampire or Dracula type book or TV show or movie that you like
So I was yeah,
that stands out to you?
this is funny because it ties back into something that I told you a little bit ago when we were talking. So I'm in the process of getting my tattoos removed because in order to be a forensic anthropologist and appear in court, you want to look like the expert that you say that you are. So I'm
Yeah,
kind of
yeah, that's no, I didn't mean to cut you off there. It's just I know that that's a touchy subject for people because a lot of folks in the field do have tattoos in forensics and forensic anthropology and just that sort of death side of the field, mortuary science and stuff. Almost everybody has tattoos, and yet if you are going to appear in court, it's it does, I think, affect some things. I try to tell people not to get tattoos on their face or their neck or their hands. That's usually what I tell people, and the rest of them you can usually cover up.
yeah.
Anyway, sorry, go
Yeah.
ahead.
Oh no, you're fine. But the one that I'm really struggling with having removed, so it's and it actually this is crazy because it ties back into like this whole conversation, but it's a movie called Shadow of the Vampire. And it's like a
Mhm.
metafiction based on FW Murnau's Nosferatu. So like I just
Mm.
watch it. It's hard to watch right now. I'm not sure who owns the rights to it or if anybody does. Google it. You can rent it from me. I have it on
See,
DVD, but so it's a great movie just in and of itself. It's very artful, wonderful film. It's funny. Like you, anybody I think that watches it would love it. However, and I won't go too much into detail just because I don't know how much of this story is like that this director of this film tells like on stage or anything, but he had told a story about he had some health issues and just using a line in that film to get this MRI radiologist to look closer at one of his scans, and it was if it's not in frame it doesn't exist, which kind of ties back
mm.
into Stoker's talking about photographs, x-rays before they were kind of around the time that they were invented, and he wouldn't have even
Yeah.
necessarily known that. So ties back into that, but then it resonated with me so much because I was just like, I don't ever want a patient to ever have to beg me to look harder for something that is a part of
Mhm.
my job. And
Yeah.
I was very overwhelmed with that sentiment, and so I have a tattoo of Nosferatu on my thigh, with like one of those
Hmm.
old cameras, and that phrase, if it's not in frame it doesn't exist, on my thigh. And the reason I got it is because we all struggle with burnout, right? Like that's a huge thing in healthcare.
For sure.
But sometimes I would like, if a patient was really frustrating me, just based on, obviously their frustrations with not being able to have answers, like that's very frustrating, and scary
Yeah.
sometimes. So, but I would like be in my office and I would just, remember that that tattoo was there and what it meant to me and what it meant to this person. And, the fact that, film is like something that inspires everybody from real life stories like that. And I was just like, I will never not look twice, three times for somebody ever.
Yeah. Well, see, I knew you were going to have an example that was going to be sort of artsy and esoteric and deep meaning it. And meanwhile, I'm over here like, oh yeah, Count Chocula is my favorite cereal. I'm just like I knew you were going to pull something. I can always count on the Grayscale Queen to do this. I have to say, as far as pop culture goes, I always like to touch base with you on that. Um, I have not been a big fan of vampire stuff. I am not a Dracula. I am not a vampire guy when it comes to, horror movies. And I do love horror movies.
Mm-hmm. Yeah.
Um, I think, yeah, I think literally my favorite iteration of Dracula is probably like that movie from like, I think it was like 1987, The Monster Squad. Do you remember that movie?
I do.
I just did you watch that one? I love that movie. That's like one of my favorite movies. That's probably it. And then, like I told you the other day, I was talking to her the other day about there was a movie called Fright Night that came out, I think, in 1985. And I loved that movie when I was a kid. I used to watch it, and that's sort of aging me. You sort of know that I'm, getting up there in years. But I used to watch that all the time. They used to play it on HBO. I used to watch it all the time. And the other day I was bored. I was working on autopsy reports or something, and I watched the remake, which came out, I think, in 2011 or 2012, and it had Colin Farrell in it, and had Toni Collette in it, and a bunch of other like at least B-list stars, like people that you recognize. It was pretty much an all-star cast, but I did not like it. I don't think it I think it paled in comparison to the original. And it was really a different story from the original. I don't know, have
I,
you seen it?
I did see it. I actually saw it in the theater with my brother. But
Oh,
I felt the same way. I wasn't necessarily I have a huge issue. I feel like I don't want to like say just kind of like medicine, never say always, never say never. I don't want to say never do remakes, but
yeah.
it takes a lot to actually remake something if the original was so great. So I'm not a bit, and it seems to be
Yeah.
dominating what you see in, Hollywood at the moment. And I'm not feeling
Yeah,
it.
I'm not a big fan of remakes either. And the first movie, I mean, it's not like it was some sort of cinematic masterpiece. I mean, it is literally just that classic 1980s horror movie, campy type stuff, somewhat
Which
humorous.
works sometimes though.
Um, I love it. No, I actually love it in that particular genre. But then they switched the setting to like a tiny little town in Nevada or something.
Mm-hmm.
And I won't give away all the details, but there is some mirroring with the original, but it really fell short for me. And I don't feel like my entire life was wasted while watching it. I was glad to see it
That's
because I
fortunate.
always like to see it. Yeah, yeah, it wasn't a complete waste, but at the same time, I was like, man, why didn't they just make this a completely different movie? They literally used the title and then just sort of, I don't know, it just didn't seem to fit at all. I would
Did
have rather
you
seen it as a sequel.
did you
Yeah.
see by any chance? I know you said that you're not super into vampire movies, and I feel bad because I feel like I'm giving a little bit of this film away, but the most recent vampire movie, Sinners.
No, I did not see it, but I heard good things about it.
I I had a very, like I said, I'm half Cherokee. I had a very lovely experience where I took my Native American mother to see it because there's again, I'm not going to give it away, but there's a part in there that I was just like, she has to see this. And then my girlfriend, who's Wintu, she took her Wintu mother to go see it, and same experience. It was just like
Hmm.
it was kind of like a mother daughter thing for both of us. But
Uh,
the Southeast, like the myths that come from the Southeast, some of them that I grew up with, And again, like Choctaw, Cherokee, like these tribes can be very hermetic because, and it's kind of a fortunate thing for me, I feel like, in a lot of ways. Like there's not a lot of our culture that can be stolen because it's not readily available. Like there's so much about Southeastern tribal
Mhm.
culture that you literally cannot Google. You will not find it, I promise. And it's one of the
Cool.
things that's even protecting us from AI. So it's just, I like that you
Yeah.
can't Google
Well,
it,
that's
but
good.
at the same time, like some
Okay,
of
kids.
these films that are kind of zeroing in on that, I think that that's cool. That's real. Their take on vampires was very
So
cool.
So Jesse has produced for us a book to read for the Knife After Death book club, and now a movie. Most of you've probably
Two
seen
movies.
Sinners because it was very popular and it got like good reviews. I just haven't gotten around to seeing it yet, but now I'm going to add it to my watch list, and maybe on our next podcast we can talk about that. Um, and speaking of that, I think we can probably. I don't think there's anything else we need to cover today with this particular
No,
thing.
I was
So
looking
maybe
at
we can
the
sort of,
I was looking at the docket. We
yeah.
got all the way through. The only other thing I wanted to
Hey,
address, and this is a technical issue, is there is a little bit of lag on this video. I'm going to troubleshoot that, but Dr. Wolf is not talking over me. It's just technicality. So
yeah.
yeah.
So yeah, and we probably should have addressed that up front because we did a podcast together before, Jesse and and I got some like hate mail comments about how I was talking over her and sort of railroading her, and she didn't feel that way at all. We talked about it afterwards, and she felt bad because I was getting killed online with people saying I was talking over her, but I think it might have been due to a delay because we're not in the same place right now. We're not in the same house. Maybe someday we'll do some on location podcasts. But if you're listening and you're thinking Dr. Wolf's talking over Jesse, please, I'm not trying to. We already talked about this in the pre show before we went on air. And we're going to try to work out some technical issues. We just kind of wanted to get going again. People have been
Very
asking for the
nice.
podcast to come back for so long, and I get direct messages literally every week. So we're back. I'll see you next year. No, I'm just kidding. We'll probably, I don't know what our frequency is going to be, but I would love to once a week if we could. Um, and we've got a couple of things that we want to talk about, and one of them is an autopsy case, which people have been begging me to go over. And I think that
I
did we
watched
we
the
talked about it,
documentary
right,
on that, by
Jesse?
the way. You need to watch the documentary because I did, and I was kind of appalled a little bit. I didn't think that I was going to be as
Uh,
upset as I was. So
Okay, so this is Ellen Greenberg. The case is of Ellen Greenberg. This is a woman. They recently, and I think the case happened like 10 years ago or so, right? Something like that, maybe. And it was ruled a suicide. And then it was reopened and ruled a suicide again. But everybody who kind of studies the case, or like lay persons, I guess, I swear that it's a homicide. So lots of people have asked me, and there was a lot of stab wounds, I think, on the body. There were stab wounds in the back of the head. And I said, I don't know anything about this case. And somebody sent me the autopsy report. So Jesse and I might be taking a look at that, and we're going to try to do that as a podcast. I don't know
right.
that it's going to be next,
Might
but it
not be
could be
next,
next.
only because we definitely need to verify those records. Just so everyone's aware, there are fake autopsy reports, like a plethora of them
Yep.
online. And if you're not
Kurt Cobain.
precisely,
Yeah, like Kurt
um,
Cobain. Yeah, a lot of them are autopsy reports of very famous people, particularly musicians. I've had people beg me to do the Kurt Cobain case, and I say, "Give me an autopsy report, and I'll do it." And then I find out that apparently there are fake autopsy reports online of his, but the real one has never been released to the public, from what I understand. Now, if I'm wrong about that, please let me know.
no,
But
the last
we are.
thing that I saw from
Yeah.
another pathologist, he was very adamant about the fact that that had never been released to the public.
Oh, there you go. See, that's great. So we may be tackling that one, but yeah, we have to verify it, and I need to watch the documentary. I need to read the autopsy report. So it may not be our next one, but it will be soon because people have been begging me to do this case for so long. And I do like talking about this sort of thing because I like to go into the mind of the forensic pathologist, and we don't all agree, but sometimes I can see where they're coming from, and I think that that's helpful. And Jesse and I will try to make sure that it's real information. We don't want to put something out there that's not real information. That would
Yeah.
be
You know
I
what?
don't want to I don't want to have to issue a retraction.
That actually makes me want to bring this up because it was something that I talked about on one of the podcasts that I did when it came to the original pathologist of the West Memphis Three. When
Hmm.
I think a lot of people, a phrase that I use a lot in my head is always assume stupidity unless you can prove malice.
Right.
Some
Yeah.
people are malicious, they are, but for the most part, just I think attributing things to lack of education or like some level of like just like unassuming ignorance, that more so that, and the fact that just because
Mhm.
somebody is a pathologist does not mean that they're a forensic pathologist. That is a
Yeah.
very different skill set. You're trained to look at things that would happen to a body that would not happen typically if it was just like, natural disease process.
Hmm.
So like for instance, those bodies being submerged in water for as long as they were, um,
Yeah.
there was things that happened to orifices that pathologist that did that original report said something else happened, and that wasn't true. He just wasn't
Hmm.
used to seeing that area of the body
Yeah.
look like that. So he's not used to animal
Absolutely.
predation, anything like that.
Yeah, and that's a great point because pathologists do a little bit of autopsy during residency, and then they go work in the hospital, and they might do a couple of autopsies a year, but it's a different universe from regular hospital pathology to forensics. And then even within forensics, there are forensic pathologists who mostly do just sort of like what I would call like country forensic pathology, which are just the heart attacks, the car accidents, maybe a drug overdose here and there,
The
but they don't
occasional
see
ligature.
homicides more. Yeah, ligature, exactly. And they might see one or zero homicides a year. And then you've got pathologists that work in, Chicago and Miami and New York, and they're seeing 100, they're doing 100, 150 homicides by themselves. It's just a different level. It's almost like, professionals basketball versus, high school basketball or something. And
Yeah, I mean, the
I'm not trying to denigrate anybody's experience, but it's just completely different in that some of us will disagree ardently on things, and a lot of it is based on our experience or lack thereof.
there's one of my favorite books, and I feel so bad. Like I used to have his name memorized because when I purchased this book, I didn't know that he'd signed it for somebody and this person had then resold the book, but I have his autograph basically like inside the front cover. It used to be one of my favorite books, but it's Stalking Death in Louisiana. And he was the
Hmm.
chief medical examiner during Hurricane Katrina. So obviously, when all of those
Oh,
graves were kind of unearthed with the hurricane that came through,
wow.
he was also the chief medical examiner
Nightmare.
when there were two serial killers loose in that area. So I mean, his experience versus,
Mm.
and kind of like Dr. Wolf said, like it's not to denigrate anybody. It's just his experience in Baton Rouge, Louisiana, versus somebody else who, like you said, only does like certain types of autopsies because that's really the only type of death in that area that's very common. Those are going to be two completely different
Hmm.
experiences. They just are.
Yeah. Well, like the example I always give is that people in forensic pathologists in Florida are really good at well, they're good at a lot of things, but I'm saying they're going to be better than me at things like alligator bites or scuba accidents because in the middle of Indiana, I don't see that. But I'm better at things like hypothermia and hunting accidents. So, things like that. So it's regional, which is kind of cool. It's kind of cool, and that's why it's nice to kind of talk to other people who have different experiences and you can learn from each other, just kind of like how we're doing. But I think I don't really have much else to say on this topic tonight. Um, and if you have nothing else, I guess we can uh, put this one in the books
We
and
can.
get
We
on
can
to our
upload our
next one.
first episode.
This is exciting. Season 4, which is completely arbitrary, but I'm calling this season 4, episode 1. And also, you can find us on social media if you want to reach out and, ask about, some questions that you have about the podcast we just did, or if you have suggestions on things that you want to learn about.
I'll be making
We're
us
both on
a
Instagram.
Google email
Yeah.
that's just going to be Knife After Death, like whatever. I'll let you guys know what it is. And then you can just,
Yeah.
yeah, send us questions or anything, anything interesting. Um, there's one person that did agree to send me some very strange looking pathology for you to look at and us to discuss.
Okay.
So if that's something that you guys are okay with doing, that's fine. But it just understand, obviously no information will be utilized at all. Like it would just be a random photograph. Just understand that if
Yeah.
you're the one that sent it to us, it would be a piece of you. We're not going to say who it was, but
Yeah. Yeah, we're gonna we'll make sure and keep things private and we definitely get the permission if we're gonna do stuff like that. Um, but yeah, that's it. I'm glad to be back. I'm glad to see Jesse again, and hopefully you guys enjoyed the episode. It's Halloween. It just seemed like a great time to return, and we're gonna try to put out some episodes between now and the end of the year, and we'll see what happens. So you can find me. I'm on Instagram as the Dead Letter, or Dr. Darren Wolf. You can do either one. Find me there. Facebook, TikTok is also the Dead Letter. My YouTube channel is Knife After Death, which this video portion should be up on the YouTube channel at some point soon. And yeah, you can find me and you can pose your questions or comments to me. We can do a hate mail of the week, maybe.
I would
Each
love to do
episode.
that just because so I've actually interacted, like when you introduced me as your producer, I've interacted with a couple of your fans and they are very sweet people. I like all of them, but I know for a fact that a lot
Oh,
of you passing through are animals with your comments and you just need to chill. But I guess if you're gonna send them, just understand that I will read them and just kind of giggle about it. So
oh no. I hope they're nice to you.
oh, they're nice to me so far. It's
I've
just
been
the
on
ones that
social.
the ones I've seen to you, I've just been like, I don't get
Yeah,
it.
I'm grown numb to it at this point. I'm covered in scar tissue. Um, Everybody seems to know everything about forensics. That's all I know, regardless of if they've ever seen a dead body.
It just takes a
All
quick
right, well,
Google
that's
search. I
it.
don't know what we're
So
complaining about.
one Google search, yeah, one just ask ChatGPT and you can figure anything out, right? Um, but yeah, we'll see you next time, and thanks for listening and watching.